How are you? My name is Dr. Worthington, and I will be working on your face today with some PDO threads for a thread lift procedure. Okay? I like to give you this mirror, and I want you to take that, and I want you to tell me what bothers you. This jawline?
Yes.
Right in here?
Yes.
Like that a little bit tighter? Okay.
Pero un poquito.
Yes, a little bit. To see that.
So, I want you to look straight ahead, right through there. Now, it's important to have your patient sit up very nice and straight and make sure that they're holding their head like they normally do. A lot of times patients will hold their head up or turn it to the side, which is going to distort how their lines may appear. So, chin down slightly, Lucia, and look straight ahead there. So you just want to get a natural profile. And what I see on this beautiful young lady is she's concerned with a little bit on her jawline. So we can see she's got just a little bit of jowly here, just a very small amount on this side. And then on the other side, let's take a look. I always like to look at my patient from both sides. A little bit right through here, but it's very mild. And so what I also see on her, do you sleep on your side, ma'am?
¿Usted duerme de lado?
No.
¿Cómo duerme? She sleeps face up.
Face up, okay. It appears that this little lines on this side are slightly a little bit deeper than this side. So what I see is a little bit of nasolabial fold right through here, and very slight marionette on that side, but mostly nasolabial fold, and then the jawline that she's concerned with. She has very little to pull back on her jawline. I think this is the most prominent thing on her face. So if we could lift that up and back and minimize that just a little bit, that would be perfect for her. Other options for her, if we put filler in there, what that's going to do is just going to make it fuller. It's not going to lift, it's just going to fill this area. So a better option is to use PDO threads. I would do a thread lift up and back, this area and this area, and then bring her back in 30 days. Anything that was left, you could touch up with filler if you needed to. But with the thread lifts, I think she's going to be very sufficient. I'm going to draw it on here before we clean her face. Right here is going to be the insertion point. Now that's kind of important. I want to go at least 1 finger's width out from the ear, because we know that that temporal artery runs right down in front of the ear. So you put your finger there and you just feel for that temporal artery. And if you're 1 finger's width out, you can generally miss it. Everybody's face is a little different, but I tend to feel safer in this area. So my insertion point's going to be here. And with her, she has a mild fold here, and it's very mild here. So I'm going to go here with the thread, and I'm going to go through the fold slightly. I want to go just past it so I can lift up and back. And then I'm going to go right down here on her jawline. Since her jawline, she doesn't have a lot there, I'm going to go about 1 inch below, again, about 1 finger's width out, and I'm going to go right down here with the thread. So we're going to put 1 here, and then we'll put 1 up here. And so that's going to go up and back.